Good stuff, though. Good.
All right, I'd like to call the meeting to order. Let's start by saying the pledge, please. Borough President, if you'd like to lead us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, we just have to get just a few housekeeping items done first. So if we could, the minutes are in your packets, if everybody could just take a look at them quickly, and if I could have a motion to accept them, please.
Motion to accept.
All right, Dana. Can I have a second? Dan? Okay, thank you. We do not have any correspondence, so let's move right along to our presentation. We have Dr. Mary Travis Bassett from the Commissioner of the New York City Department of Health and Mental Hygiene here to give us a presentation. So, Commissioner, the floor is yours.
Thank you. Thanks, everybody, for coming this evening. I should acknowledge my team that joined me, although I have to confess I don't know everybody by name.
Pauline Ferranti.
Okay. And you go to the room, my chief of staff.
Nick Sinclair, Chair of Community Board 1.
And should we go around?
Yeah,
the
I was just
room?
going to say, let's go around the room, please. All right.
Nick, Dana McGee, Chairman of Community Board 2.
Jerry Goldman, Vice Chair, Community Board 3.
Marie Carmody LaFrancesca, Borough President's Office.
Hi, Christine Johnson, Councilman Rose's representative.
Daniel Castrino, Minority Leader, Stephen Nadio's office.
Dr. Judy Mayfellow, Director of Health and Wellness of the Borough President's Office.
Giuliano, Borough President.
Joe Gallo, Board 1.
Okay.
Sutherland, Rathbone, Wells.
Okay.
Michael Rowe, Department of Finance.
Okay, go
Glenn
on.
Yost, Council to Senator Andrew Maxson.
Good afternoon.
Okay.
I guess we should sort of say a little bit early evening, afternoon. These clocks, I'm hoping.
Clock hasn't been turned back yet.
None of the office.
I appreciate everyone, taking this time today to get together. And I want to point out that we have copies of the community health profiles that all of you are welcome to take. And I'm pleased to say that this is the third round of rollouts of these profiles that we're doing. We started in Brooklyn with the Borough President, Eric Adams, and rolled out the Brooklyn profiles, and then in Manhattan, and now we are here in Staten Island. So I know you always think that we need you to last, but we are here, and we have committed to getting them rolled out. Can you all hear me without this? Sure. Yeah. We're committed to getting these all rolled out, or you just want to by the middle of this month. So, this has been a really big effort on the part of our department, and we wanted to have these community health profiles in part because we know that New York City is a city of neighborhoods, and that's part of what makes our city so wonderful. Every one of us probably describes ourselves as coming from both New York City and a neighborhood in New York City, and it's that history, that richness, that diversity, and that's why we created the community health profiles by community district for the first time. We first began, next one please, we first began issuing community health profiles in 2003 under the leadership of then Health Commissioner Tom Frieden, and they were issued again in 2006. And there haven't been any since. And when I became health commissioner, I was going around and finding these dog-eared copies of the 2006 profiles on people's desks. And I thought we should do this again. But we wanted to do them for the community districts because and even though this was a much bigger job, we used to issue 42 of these, now we've issued 59. And that's because the community district really is the sort of most local level of decision-making in New York City. And with the community boards, we hope that these data will help inform decision-making and also become available to people who live in the neighborhoods, the residents themselves, the organizations that promote the health of the residents, and the general well-being of residents. And the reason that we care about this is because we know that here in New York City, the next one can do that, we see huge variation by neighborhood in health. So every neighborhood has assets, but we know that not every neighborhood has the same level of health. And I show this slide a lot, using various titles, because it tells us a couple of really important things. I don't know if you can all read it from here, but what you all need to know about these maps is that the darker the color, the bigger the problem. So you can see that there are certain neighborhoods, and in Staten Island, it's the northern rim, that seem to light up all the time. And look what they light up for. They light up for non-communicable diseases like diabetes, and communicable diseases like AIDS. They light up for infants, for older people, and so we know that there's no biological reason that we should see this variation. It's happening across disease conditions, across age groups, across the lifespan. And that's why we know that there's something structural about this, related to the neighborhoods, something deeper than any single disease. And it's related to the pattern of residential living in New York City, because we are a very segregated city, by both income and by race. And you can see that the neighborhoods that tend to light up are neighborhoods that are poorer, and neighborhoods where people of color are more likely to call home. And we want people to understand this, because the good news about all this is that it's preventable. We can change it. A person's health shouldn't be determined by their zip code. And there's nothing about this that we can't address. It's not as though it's buried in our genes. These are things that we can change. Next slide. So this is really the reason behind the community health profiles, that we want you to take this information. We want the community board chairs and members and everybody who lives here to use it to both advocate for resources, target resources, because our resources should be going where the problems are greatest. And these are data that we often find community organizations can pull from to write grants and to educate members about what the problems are that they face. So I'm going to go through them because there's a lot of information in these, and I would keep you here for way too long if I went through each of these. We've tried to make them digestible, visual. You'll see that they're using what these modern icons called infographics. But all of them have the same structure, that they start out by addressing who lives here. We include conditions of the neighborhoods, which is something that we didn't have in previous community health profiles, because we know that it's not only what individuals do and individual choices, but what resources their neighborhoods have to offer them. So you'll see a whole range of indicators. You'll find out the age and sex distribution. You'll find out things about smoking and whether people eat vegetables and get health care and the sort of things that Borough President Otto is growing his beard to tell us about. And we have measures like elementary school absenteeism, incarceration rates, housing maintenance issues, because we know that square footage of supermarkets, because we know that a neighborhood's resources, not only the individual choices, are what shape our behaviors. So we have added these because we want neighborhoods to be places where the healthiest choice is the easiest choice to make. So let me jump into it, because the first page of all of the profiles answers who we are. And this is because we know that that neighborhoods are changing. You may not even know yourself what the demographics look like. So here we are for Staten Island. population, just over 470,000. I don't know whether we have this graph in, do we have this graph in?
For the whole borough.
For the
not
whole
in
borough?
profile. Each profile has this.
Yeah, it has its own, but now I'm gonna tell you, this is the whole borough. And so we created this for this evening?
For this presentation.
For you all, but you all have it. It's in, you have it there. And all of you have, if you don't, if you want to just flip along. So we created this for you. You can see that the breakdown by race, the breakdown by age. This is an older population. The proportion of people who are foreign born is lower than in the city as a whole. In the city as a whole, it's nearly 40%. And the overall sense that people have about their health is really good. 83% of people say that their health is good, very good, or excellent. And it turns out, when I first heard about this measure, I thought, like, who cares what people tell you about their health? But it turns out that people are pretty good assessors of their own health. And it correlates very well with the other measures that we find. And so this is broken down by each separate community district. So you can see that for which community district, you all know yourselves by numbers, and I've learned you by name. Which one is St. George Stapleton?
That's one.
That's
One.
one. Is that,
Is three.
who is that you, Sue?
I'm one.
You're 1, 2, 3. So you can see that that's close to 180,000. That down in the corner, the life expectancy is 78.2 years. And that down in the corner is self-reported health status. And all the information about the breakdown, you can see, for example, that the reported life expectancy is a little longer for Tottenham Great Hills. So we have, we are providing this both so that you can compare them by looking across different community health profiles. So you can see, for example, that half of the population in St. George Stapleton identifies as Latino or Black, whereas Tottenville is predominantly white. In St. George Stapleton, there's also a higher proportion of the foreign-born. I think I came to St. George when during the Ebola outbreak, because there's a Liberian American
Yes.
and
The Park Hill area.
because we especially wanted to reach out to them and the African African immigrant and African descendant population, and you can see that the St. George is actually above the citywide life expectancy. And Tottenville, Great Hills is a little bit above. Yeah, no, you can absolutely, we're a small group, so.
You said St. George and Stapleton, but, what about the other North Shore neighborhoods, for instance, Port Richmond and Mariners Harbor? We know how.
We don't have, because they're all subsumed in, I don't know whose community district. This is all done by community district.
So this is actually the entire North Shore Community Board one. It's, even
This
though it
is
says
the
St.
entire,
George.
yes. I mean, I don't know where we got the names.
On the inside.
If you look at the individual reports, Ginny, it has the other names on them.
Including all of the.
Yes.
Okay, so it includes the entire
Yes.
CD one.
Or,
It does?
repeating the name.
Yes.
Oh, I see. We just took the biggest areas.
It's a kind of a common.
I know, I would have called it St. George's, but I know Port Richmond and St. George's are the ones that I've heard of.
Oh, I
So,
see.
here we go. Oh, where are they listed there? Oh, there we are. It includes Grimes Hill,
Yes.
Mariners Harbor, Port Richmond, Stapleton, St. George,
Yes.
Lakeside.
Yes.
Yeah.
It's
So
on the
it's
front
the whole of
covers.
community.
It's on the
Yeah.
front covers of
And
each
it's
of
on
the
the front
books.
covers too. Thank you. So there we are, and there's the map, and it shows the parks and everything. Good, okay. So let me move on then to talking about the neighborhood conditions. And this is the way the community health profile differs from the way in which we provided information in the past, because we know that the air that we breathe, the sense of security that we have in our neighborhoods, the availability of of retail products, both unhealthy ones like tobacco and healthy ones, because supermarkets are important. They have that outer ring where produce and meats are sold, whereas the drugstores that sell all dry goods don't have that. So we know that in neighborhoods that have supermarkets, they have better access to fruits and vegetables. So we include all of these in our assessment of community neighborhood resources, and each neighborhood is ranked on this indicator. And I want to remind you, we rank them from 1 all the way down to 59. And so people can see where their district falls on that whole continuum of 1 to 59. But being number 1 varies in whether it's a good thing or a bad thing, depending on what indicator you're looking at. So you need to pay attention to whether it's something you want to see. I personally, sometimes the health commissioner wouldn't want to be in a neighborhood which is number 1 in terms of tobacco retailer density, because I wish it was a little harder for people to buy cigarettes. But some things, of course, we want to be in number 1 in terms of air quality, for example. So let me just show you some of these measures. So this is what you're going to see for just about every indicator that we have in the community health profile. And it makes the graphs a little complicated, but I think it also gives people a lot of the information that they want. So this one is on maintenance defects, and it's a graph telling us about South Beach and Willowbrook, which is in which community district?
2.
Community District 2. So that's this gentleman, yeah. So you can see that South Beach Willowbrook is 1 from the bottom. This measure is the percent of renter-occupied homes that have at least 1 maintenance defect. So the higher the number, the more maintenance defects there are. So you don't want to be number 59. You want to be, you don't want to be number 1.
I was going to say, because
Oh,
I'm number
sorry.
59, and I was
Sorry.
wondering.
You don't want to be number 1.
I want to be 60.
You want to be number 59. And so, no, Greg Carroll says number 59, and next comes Southbridge. Willowbrook gets ranked 58th. And with the green bar always represents the 59th, am I right, Kendra?
Unless they're tied.
Unless they're tied.
That's for one.
Okay. So we always put the best performing district on these graphs, and then there are 2 lines. There's the line that shows the average for Staten Island, and then there's a average that shows the average for the New York City as a whole. So everybody looking at these community health profiles can see where they rank compared to other neighborhoods, can see where they rank compared to their borough, and can see where they rank compared to the city. So you can see from this that Staten Island has much higher quality housing stock in its rental housing units than the city as a whole. It's, in general, it has about half the number of units that have maintenance defects. And you have several neighborhoods, I was looking through this before, that are ranked quite low, although you won't be surprised that St. George doesn't rank as high as the community district 1, 2, and 3. Yeah, it's all 3. Actually, I take that back then. So you have the best housing stock in the city in terms of rental units. Or else you're not reporting on your maintenance. And that's really important. And I should point out, in case you think that this is just about, whether you have good landlords or not, it is relevant to health. We know that having leaks and mold, having mice, in a housing unit, these are asthma triggers, and they can trigger asthma attacks in children and adults.
Commissioner, how do you know, let's look at.
This comes from these
No,
data.
let me ask,
Okay.
that's not what I'm looking for. Port Richmond and Staten Island, high incidence of asthma. Westerly, almost, no asthma. but these data just lump them all together, so how do we know? which is
Then I
where
can't,
we're-
then I can't help you. Yeah, we have on our website something called EpiQuery, which might, can that help us at all? Maybe not. I mean, 59,
Particularly for this housing
yeah.
stuff, I mean, that should have housing vacancy survey.
Right.
But for all the areas
It's
that
hard
we,
to break things down to very small levels.
Yeah, this is much smaller units than we've ever done before.
Yeah.
This is the most detailed information by neighborhood that we've ever provided as a health department. But we're not distinguishing between the neighborhoods that you've just mentioned.
So we're trying to do some hotspot mapping with the
Yeah.
district, and then it's all only Medicaid, because
Mhm.
it only gives us
Yeah.
access to state Medicaid data. But that's going to be so specific that you can actually, within a couple of mile radius, be able to say, this is the epicenter of the asthma, or whatever else we're looking at. Right now, they're able to hotspot map zip code level, but they're fine tuning it down to like blocks in our community. But
Right.
it will only be Medicaid.
And you're doing that probably with hospitalization or emergency department visits. So that will tell you about asthma. What I'm
Admission.
hoping that people will do is exactly what you've just done, sir, is say, well, let me look at my housing information and see how it lines up with my asthma information. And in your case, either we're averaging inappropriately across neighborhoods. I don't know your neighborhoods well enough to know how different they are from one another, and whether maybe all your maintenance defects are in Richmond and none of them are in the other. But the actual visits for asthma, either hospitalizations or emergency departments, also are determined by the medical management of asthma. So it's not only the triggers, although that's really important to think about. We want people to think about it. It's also whether a child is diagnosed and whether their condition is well managed. That can have something to do with whether or not they end up in the emergency room or hospitalized. So I don't want you to think that housing is the only determinant of whether people have asthma or not. Okay. So that is maintenance defects. And I'm going to turn to the next category that we are talking about, so that was an example of a measure that we have of neighborhoods. We also have information on incarceration rates, as I mentioned, supermarket square footage, air quality. All of these are things that an individual doesn't have that belongs to a neighborhood. And we also have a whole other category. Incarceration is under social and economic, I understand. But we also have a whole other category about the economic and social conditions of neighborhoods, because we know that these also have an important bearing on health. We know that educational attainment, school absenteeism has a bearing on health that both can reflect health outcomes. Kids don't go to school when they're sick, and it can determine health outcomes. The level of violence in a neighborhood, which is measured by non-fatal assault hospitalization rate, has a lot to do with the sense of security that people have in the neighborhood, and also reflects health need. So these are issues that we want people to think about, because we know that it contributes to the context in which people live and whether or not they are healthy. Let me think if there's anything more. The other thing to note also is that we know from data that, say, I can just use myself. I live in a poorer neighborhood than my income could reflect. Sorry. So I live in Inwood, the northern section of Manhattan. It's not a very wealthy neighborhood, and our data show that the fact that you live in a neighborhood, the overall economic well-being of that neighborhood affects your health, in addition to your personal economic well-being. So all of these things go into affecting our health. We really are not an island, and you can't just say, I'm okay, and I live in a neighborhood that's not, because all of it affects our health. And here we have some more examples of measures that we have that reflect socio and economic conditions. And these relate to poverty using the federal poverty line and unemployment. And again, this is information that is in each profile. It's the percent of residents who live in poverty and the percent of residents who are unemployed. Anyone knows that living in poverty or being unemployed is a stressor, that it increases personal insecurity, family insecurity, and it may represent a challenge to making healthy choices about your life. So we know that unemployment and lack of affordable housing are closely tied to poverty, and poverty is an important correlate of poor health. So at 6%, Tottenville, is it Tottenham or Tottenham?
Tottenville.
Tottenville and Great Hills has the lowest poverty rate in the city. Yeah. And it's, that's where you can see that the best performance in the city is with a green star.
What does that mean, best performing community district?
It means that it has the best, that it has the lowest rate, and not just in.
Lowest rate of poverty
Yeah,
Yes.
the lowest rate of poverty, not only in Staten Island.
in New York City?
But in New York City. So this means out of all 59 community districts, this is the one with the lowest rate of poverty. You may not have known that.
Oh, I knew that.
You did?
I had that feeling.
You did.
You see what they sell houses for, they,
Well, I have to confess, I didn't. I thought it might be the financial district, but I was absolutely wrong about that.
you can visit me anytime, I'll give you a tour. I mean, I won't usurp the authority of the borough president to give you a tour.
Oh, man, no.
I live on Main Street, how more Tottenville could I be?
So it has half the poverty rate of Staten Island as a whole, and as you can see, that as a whole, Staten Island is much less poor than the city as a whole. But that's in contrast, not too far away, to St. George, Stapleton, and all the other neighborhoods that we mentioned are in Community District 1, where the poverty rate is much closer to the city as a whole. 1 out of 5 families in the city as a whole lives below poverty. And I don't know if you're all aware about what the federal poverty line is. It is a totally unrealistic cut point. I think now for a family of 4, it's something like $26,000. I don't know how a family of 4 can live on $26,000. So when we say that you can really kind of double that proportion to look at the proportion of the population that's at or near poverty. Again, with unemployment, you can do this very same thing, very low unemployment rate, but not quite the best performing in the city, I guess. Because the best performing in the city, as you can see there, has an unemployment rate of 5%, and that's Greenwich Village in Soho. So you can see, compare yourself to who does the best, which is where all of us want to be and where all of us should be. And you can see also how you do according to the borough and the city as a whole. And unemployment in St. George Stapleton is a little bit better than the city as a whole. So it ranks in the middle of the pack for community districts at 29. And again, Staten Island is the best performing in the city. It ranks at 59th. And in terms of poverty levels, we already said that Tottenville has the lowest rates of poverty in the city. So I think the important thing to note here, really, from the point of view of the whole borough, is the variability that you have. You knew that anyway. Now you have numbers to go with it. Healthy living is the next category, and these are ones that I think are probably substantially more familiar to you because we all have been talking about these measures: self-reported health, smoking, physical activity, obesity, diabetes. These are things that we worry a lot about, and I know that here in Staten Island, all of us are really alarmed about the issue of drug-related hospitalizations, and if we have time, I hope I'll be able to show you some additional information about that. So here, just to give you an example again, we give for the proportion of the population that drinks one or more sugary beverages a day. Looking at South Beach, Willowbrook, you see that it's about the same as the city as a whole, about the same as Staten Island as a whole, and that Stuyvesant Town and Turtle Bay are the best performing in the city. Also, in terms of eating fruits and vegetables, South Beach does about the same as the city as a whole, as does Staten Island, but we do have Bayside and Little Neck that has a whopping 95% of people reporting that they have a serving of fruits and vegetables every day, so we should all be aiming for that. And next, we move on to obesity. Here, look at that. Staten Island is doing really, really well, but it has a problem with overweight and obesity.
Certainly do.
And, you know, there are neighborhoods, Stuyvesant Town, Turtle Bay, where the proportion is 8%. That is threefold, fourfold lower. So we can't say it's undoable, because we have a neighborhood right in our city that's doing it. But we can see that as a city, we are enormously challenged with nearly 1 in 4 adults obese. So next one. And last, we have more information than we have had in the past about healthcare, because we know that having access to healthcare is an important part of being healthy. And we want everyone to have access to health care. It's part of what we've been seeing real gains with the reduction of our population that lacks insurance since the Affordable Care Act. We've seen a 35% reduction in the proportion of New Yorkers who report that they don't have insurance. And there's a lot of preventive services, some of which the Borough President has listed on his list of his Don't Shave list. Lots of, you can get vaccinations. Normally, I would be wearing my flu badge to remind you all that it's...
Tomorrow, HHC, free flu shots here.
Right here.
Good, so, yes.
It's not too late, right?
It is never too late, just about. Anytime in the flu season hasn't started. No, the State Health Commissioner gets to declare the opening of flu season, and last year he declared it on November 17th or 18th, something like that. So, but it's better to get your shot before then, because it takes a couple of weeks for it to kick in. Yeah, exactly, for your sort of antibodies to rev up. So this is a great time to get it. It's never been easier. And there are, of course, other vaccinations that we want people to pay attention to. We've been pushing hard on encouraging HPV vaccination for children as a way of reducing their future risk of cancer. And we know that we need HIV testing to really be part of adult health care. So let me show you some of these. And you can see, you ought to have a contact, because I don't know if you all know the Bronx, because you are like in another country from the Bronx, since we're a big city. But Mott Haven and Melrose, Hunts Point, Longwood are not wealthy neighborhoods, but they have the best performance when it comes to flu vaccine at 50% of adults. Now, do I think that's good enough? No, but they're the best in the city. And Tottenville, Great Hills is the one that highlighted in the slide, and it ranks 32nd. That's below the halfway mark in terms. So we can do a lot better there. And Staten Island is doing a little bit worse than the city as a whole on flu shots. So
Do we know why, what Mott Haven and Melrose did? Did they do
I don't
community
know.
drives?
That's a very good question. It's a very good question. I don't know. Maybe, there are, within the population, there are groups that we really, really want to get their flu shots, and that includes people over the age of 65 and very young children. So maybe they have more seniors there, and seniors are correctly following advice better than,
Why do you think?
but anyone over 6 months
Why do
should
you
get a
think
flu shot.
Staten Island was at 39%? My Staten Island colleagues.
I think the Bronx has more HHC outreach. HHC does huge outreach, so wherever you see a lot of HHC facilities, you'll see a lot of community outreach. We don't really have that here. And most people get it from the private doctors, CVS. That's what I think.
That's a thought. I mean, what we found as a city is that the biggest change that we've seen in bumping up our flu shot rates is the pharmacies also in town. There's just no easier place to go to get your flu shot than a CVS or Rite Aid or Duane Reade. You must have those.
They do. The
Yeah,
CVS
we do.
offers
Yeah.
them.
We still see citywide, right, the resistance to the flu shot.
Yeah.
Oh, it's gonna give you the flu or.
Yeah, we
or
do.
the
We
sort
do.
of
I bet there are people
anti-vaccination
around this
Every time I get it, I
table.
get
mentality.
sick.
I think that would, don't extend, I think that would be alive and well,
Yeah.
right, in this borough?
What I find people say to me a lot, and I
I never get the
never
flu.
understand it, is
I
I
never
never
get
get
the
the
flu.
flu. So I have an answer for that now. I can try it out on you all. I say, well, do you wear your seatbelt when you drive a car? And then they usually say yes, because seatbelt has been, considered. In fact, I feel uncomfortable in a car if I don't put my seatbelt on. And then I say, have you ever been in a head-on collision? And they usually say no. And I say, so why do you wear your seatbelt?
I think patients
Well, it's
have
the
their
same
own-
reason that
they
you should
have
get your
their
flu
own
shot. Does that work for you?
personal
What's interesting to me in this is the following, the philosophy that education, poverty levels has an adverse impact on your health.
Yes.
Yet we see in one of the highest areas in New York City for education, quality education, the lowest poverty level, mediocre flu shots,
Yes.
while you have one of the least, where education may be suffering more in Mott Haven and the South Bronx, where poverty levels certainly are astronomically high compared to this.
Right.
So it's the opposite philosophy
It is.
when it comes to flu shots.
It is.
It seems to me the more you know, the smarter you are, the wealthier you are, you don't take a flu shot. If you're living in poverty, your schools are not functioning properly, you don't know that much about, they're getting the flu shots.
Well, we should all do so well, because it is really not true that the flu shot makes you sick. And it really is true that it protects you, although there are groups that are higher risk than others, and older people in particular, and anybody with an underlying respiratory disease.
My patients also feel with that, though. They say, I never had the flu. Every
Yeah.
time I get you give it to them, they will make themselves sick. I've seen it a million times.
Yeah.
And if I say, I told you.
But it's not true.
Don't even push it if they don't want it, because
It's a pity, because it really does.
yeah, they really refuse.
And it
They
would
refuse,
reduce the
but-
community circulation of
Yeah.
the flu. That's why we're pushing it in kids, really. Yeah. Not only to protect the little kids, which we want to do, but also little kids are like little vectors,
Well, they bring the message home.
Oh, they are, aren't they?
But they bring the message home. They'll be the ones that'll say,
Yeah.
Mommy, Daddy, I
Yeah.
want you to be okay. Please go get your flu shot.
Should I move on?
I go to my schools, I come back, I swim in Purell.
You and I.
Results of-
They germs are
So we have,
They get sick for 2 days, and we get sick for 2 weeks.
I do know that there are a couple of community organizations, in particular one that has 2 mobile units, that have said that traditionally they they found it difficult to get pods. Is there somebody specific that we should be able to refer them to at DOH that can help them so they can then infiltrate into the poorer areas in our community to do the mobile
We're doing
outreach?
flu shots. We're not doing that, because
No.
really the private sector's done a better job than us, and almost all insurance plans are accepted by the pharmacies.
Could we get
So
flu shots from you?
well, we, at our clinics, and do we have a clinic? I don't
One.
know. We have one.
Bay
At our
Street.
clinic, we do offer flu shots.
So we can refer.
Yes,
to
people
the
can go
clinic.
there.
I think the concern is people that cannot travel. So
Right, yeah.
Transportation is a big issue on
Right.
Staten Island. So the mobile unit can actually infiltrate into some areas where.
I guess so, but really, we aren't doing mobile outreach for flu shots because I forget, we have something like 6,600 pharmacies in the city. They are, I don't know Staten Island well enough,
Oh, there's one of them.
but they're all over the
There's
place.
not a problem.
And so they really are doing better. And it's not only the chains that are offering them, although the chains promote them. In my neighborhood, the independents also are offering flu shots. So they've just done better at it. And the challenge that we encounter is that they don't always take the person's insurance. But that problem seems to be being overcome. Certainly with the chains, they take almost all the insurance plans. So this is my last section, and it's all about health outcomes. We have a whole list of health outcomes, including the last three, which we really consider summary measures of health. Premature mortality rates are deaths before your time, deaths before the age of 65. Infant mortality is probably the most important single public health statistic. And of course, life expectancy, which appears on the back of each one of the profiles. You can see a map of life expectancy across the city. And so here we have childhood asthma. And I don't know whether did we have housing quality for South Beach? We did, didn't we?
Yes.
So you can see that, are these tied? They're tied, those are tied for rank for the best.
I think when you average it, those six,
But, all right, so it came a
Slightly
little,
lower,
yeah,
yes.
so anyway. So this one is useful in the sense that the housing quality and the childhood asthma rate line up, right? We had very high housing quality and very low rates of childhood asthma hospitalizations, ranking at the bottom of community districts in the city. Staten Island as a whole does a lot better than the city as a whole with that looks like about 40% the rate of childhood asthma hospitalizations. But St. George, Stapleton, and the other neighborhoods that go with it, as we've seen, is a more disadvantaged section of Staten Island, and we saw it and it has pretty good housing quality, ranking third, but childhood asthma hospitalizations, I think you were asking, above the island average, although still a little bit lower than the city as a whole. So is there a question about this one? I can't make it out from here, but I could look at it. I think it ranks 29th, so that would put it sort of towards the middle of the pack in terms of community districts. And here we go with these two very important measures. I have to tell you, when I was a deputy commissioner at the health department, and the commissioner wanted to make having an infant mortality rate of 5 the target. I told him, no way, we won't get there. But here we are now as a whole city at 4.7, the lowest infant mortality rate we've ever recorded in our history. When I was a medical student, we learned the two numbers for infant mortality, 10 for whites, 20 for blacks. So infant mortality rates, we've really made tremendous gains. But you can see in Staten Island that as a whole, it's about the same as the city. And that St. George Stapleton's has an infant mortality rate that really is too high. It ranks 13th. So that means that there are 12 other community districts that have an even higher infant mortality rate, but that is really too high. Premature mortality rates is another really important measure. We've pledged ourselves to seeing a 25% reduction in premature mortality over the next 25 years as part of one NYC. And you can see Staten Island again as really as a healthy borough is doing better than the city average. But once again, we see above city average with St. George Stapleton ranking 15th. And that's what it's at, nearly 4 times higher than the premature mortality rate that we see in the financial district. So that's the source of concern.
Commissioner, I gotta run out.
Yeah,
But,
let me just put this up. We're gonna be sharing these kind of data as, these, when I presented them and the borough president from Brooklyn said, well, this is very useful, but what's the action plan? And because these really sort of tell us where we are. And the question is, of course, what to do about it. So we're gonna start having those conversations with the Take Care New York, which we are relaunching as Take Care New York 2020, and we're going to be having these consultations here in Staten Island in the coming months to have conversations, one community district at a time, about what our department views as important indicators that we should identify. We've identified targets for, but we want to hear from the communities what they consider the most important.
we will help get the word out on that.
And thanks, that would be great. All right. The only other thing that I wanted to say a little bit also, and we have these data that you can look at yourself with every group. Thank you so much for coming. And then I had a handful of slides about overdose and opioid in Staten Island. If you want to see them, I didn't hand them out, but I thought that you might want to see it because I know that it's been such an enduring source of concern. So you can see that St. George Stapleton really, that there's a challenge for the whole of Staten Island. But St. George Stapleton is bearing the heaviest burden in terms of drug-related hospitalizations as a measure of substance use and its impact on the population.
So this is different from the deaths, because I know St. George Stapleton was traditionally the lowest compared to the South Shore in terms of deaths.
This is the hospitalization, it's not deaths. I think I have some data on that. These are overdose deaths, and this is showing, this is a rate, so it's per unit. It's not, I think that in 2013 we had somewhere around 65 overdose deaths from Staten Island. But when you consider your population, because one of the important things that we do in public health is not just consider how many cases there are, but what population gave rise to them. Staten Island is smaller than the Bronx, which is number 2, and so we need to take the population into account. And Staten Island, without a doubt, has the highest rate of unintentional overdose deaths in the city. And it's really affecting the whole island.
I have a question for you about the
Is that
preceding
it?
slide. The slide
Sure.
before it. Just,
Yeah, this,
it may sound like a stupid question, but I'm
Not
going
at
to ask
all.
it anyway. Drug-related hospitalizations, are you only talking about opioids?
no, this is
So
anything.
that could be a drug that I'm on for
It-
medicinal purposes, would be lumped in there with.
This would include benzodiazepines, sort of tranquilizers, which is we've seen a big increase in overdoses related to Valium, is sort of the common name for it. And to be honest with you, most overdose deaths are multi-drug cocktails. That people are using a number of drugs. The most common combinations are opioids and benzo, and alcohol is also in the mix, but also benzodiazepines and opioids are the most. So we rarely see an overdose death is due only to, you can see that, and it's only due to one drug. So you can see Staten Island is, has the highest rate of overdose deaths here. And benzodiazepines, these are sedatives, heroin is highest, opioids are highest, cocaine is highest.
Jesus, even the alcohol.
Compared to the city as a whole.
The
So
trend
this
has
is-
actually gone down on Staten Island.
Yes, and I think I may have a slide that shows that. I hope so, because
There we go.
this is really important.
Yeah.
That we can change this.
Yes.
It's really, we don't want to show people these data so you just get totally depressed and say we can't do anything. But
Look at how much higher
a
we were.
really, this was just a staggering increase that we saw occurring. And then here, a whole set of efforts were prescribing behavior of opioids, not giving people, who don't really need opioids for pain, not giving people 7 days, 3 days will do, and that's how people end up with a stockpile in their drug cabinets that their kids might use. And of course, importantly, saying that, overdoses don't have to be fatal, that we can reverse overdoses by making naloxone and Narcan much more available. Having families who have been tragically affected by overdose deaths give testimonials. There were a series of ads that were made, of Staten Islanders who had lost family members that were enormously affected. And all of these things together bent the curve. Now, it's much too high, but it does show that you can turn things around. And I really think you guys do.
Providing families of known addicts with the...
Absolutely. Absolutely, and we've been doing that. Because most overdoses aren't unobserved. Somebody's around. And if you can get to that person and reverse it, so we've been training the police, so first responders and other first responders. We've been making it available to family members, and I frankly, naloxone there's nothing bad you can
No
do
downside.
with it. There's no downside to it. In some places, not in the United States, they make it available over the counter.
I was just gonna say that.
And
It's gonna be over the counter soon.
yeah, and because you can't recover from substance use if you're dead.
Unfortunately.
We need to give people the chance to live, and we can, and the big thing, it's a big change since I did my medical training, and I'll get to you, is that you don't have to give it intravenously anymore. We used to have to go looking for veins. Everybody has war stories from there.
We had 33 saves. The chief shared this data with us, the NYPD, over just the last 6 months.
Yeah. So, and then nobody will ever, who's reversed an overdose, will ever forget it. You see people the color of this wallpaper. And now you can just put it in a nostril push, because, as you know, because we all got nosebleeds, there's a lot of little blood vessels in our nose, and it absorbs quickly, and people just come back. Now, it's not, then you shouldn't stop. You should take them to the hospital, because you don't know how much narcotic they have on board, and the reversal might be re-reversed. But it really is it's something that we should all work towards, that it's unacceptable that people die of overdoses. All right, I think that's it. I thank you all, and I hope that you, there it is. You can see the whole thing suffering from this group. Well as the Bronx, which has been enmeshed in the heroin epidemic for decades. I don't know, we really have to work in a concerted way on this. The other thing of it, of course, is getting people into treatment. And in that, New York City is fortunate. In other places, you hear that there are not enough treatment slots. But in New York City, we believe that we have enough treatment slots, and that we should be able to get people out of addiction. All right. I always am surprised when the southern end of the island lights up. So there it is. That's the number for 2013, 64. So that's terrible. We should be able to fix that. And 33 saves was.
And we are working very closely with DOHMH to get all the providers. So I've actually connected them to a lot of large medical practices already to get the physicians on board. We also have a lot of community organizations now that are partnering. Senator Lanza's office is doing a lot, and we have Community Health Action of Staten Island. They've been going to colleges, training everybody. We're trying, because I think you're aware, we have this big coalition that works specifically on substance abuse, and Hillary's come out a couple of times.
She's fabulous.
Oh, tremendous. So we do have somebody from DOH sitting at the coalition recess and, you know,
Good. So, I mean, I think beyond first responders, we really need it in the hands of family and friends.
The problem with, I just wanted to add into that, the problem with that is that most of the families don't understand or know that the child has a problem, or that their loved one has a problem, so they wouldn't even think of having it available.
Is that right?
Because the gentleman said addict families should have this, and absolutely, but first you have to recognize the state of your spouse or your child.
Do you think people are in denial?
Lots of
I think it's denial, I think it's ignorance.
Shame.
And
A lot of
combining those two factors, denial and ignorance.
Well,
I mean, you know, I'm involved with Tottenville High School. I'm the president of their football parents club. It's 150 families. I've been there for 18 years doing this. And we have had Ball City football players die of drug overdoses. And if you're talking about against the poverty level, they're living in million-dollar homes. They're excelling in school. On the surface, everything looks perfect. But this is what happens.
well, then we need to get it into their social circles.
Yes,
They say
that's,
That need to
coaches
be
and
not just parents, but it should be their friends. It should be, I don't know, like a designated driver almost, and I really like the slogan that you can't detox if you're dead.
that's right.
We need to help people survive.
I think it's gotten a little better in terms of the denial piece. I think parents are actually realizing that, and Tottenville, and specifically, the principal's been very proactive.
Oh, Joe
There's been
Scamato,
a
yes.
number of large outreach events there.
Oh, yes.
And we've had like 1,000+ parents at those events. So
And I think, yeah.
it has gotten better because I think, you know, also the advent, so we have, the borough president left, he's very, very passionate about this. So we have a number of programs out of our office. We're doing a prevention program for 5th graders. We're also doing now a movie on recovery that we're showing the anonymous people with a panel. So we're trying a multi-pronged approach, and we are trying to get the word out as much as possible. What I'm also trying to do now is get the guidance counselors involved from the schools and do like a train-the-trainer model so they can actually start picking up earlier and earlier if the children are actually having problems. Because if the parents are working or the parents are not picking it up, someone, you know, that is seeing the child 8 hours a day, maybe they could be more tuned into, you know, what, so.
And other spheres of influence are often coaches. I mean, you mentioned coaches, but I think there's some data about that talks about that being a great way to, you know, influence. Because if you're not in the world where the, you know, potential drug users are, in this case teenagers, you know, you're just not going to be able to reach them. And then NYPD also does their teen teaching, and we're in 6 of our schools now, where they work with the teachers in order to do, like, obviously anti-drug things, because being
I mean, I really, you know, of course, all of us wish kids didn't get enmeshed in drugs, but what we really don't want is for them to die of it. So it's just this navigating this path where it reminds me in a way of other really controversial topics like kids having sex and what do you do to enable them to avoid getting diseases in pregnancy. And then, of course, you don't want them to start having sex when they're too young to know what they're doing and what they're getting into. At the same time with this, we really want, I want nobody shooting up heroin without somebody nearby who could reverse an overdose. I would like to see.
Is there a relationship between the increase in the deaths to potencies? Are we seeing
Well,
out-of-control
yes.
potencies that?
I looked up before coming over here the whole fentanyl question you probably heard about, but I looked at our data and we've had 25 fentanyl heroin deaths in the past 5 years. So this doesn't seem to have hit our city. It's hit other jurisdictions, but this is this really super potent narcotic, 50 times more potent than heroin, people say. But of course, heroin is often cut with, you know, with other stuff, milk powder and stuff. So, you know, it's not like it's put together in a laboratory. So the potency does vary, and people don't know.
And they have
what
no,
it is when
they
they
have
don't
no
know
concept.
when they're shooting it up. So when you get a bad batch or a potent batch, you get overdoses. So that would be. So I'm really hopeful that we'll be able to continue to work to make naloxone out there more, as well as all the other things. Teaching kids about, the dangers of drug use, making sure that people know about access to treatment, talking with doctors about not over-prescribing opioids, which for some people may be the first step in opioid addiction. Well, anyway, it's late enough that we should all
Thank you,
go.
Commissioner, for coming. We appreciate it. All right, just for the Borough Board members, do we have any old business? No? Any new business? Okay, can I entertain a motion to adjourn, please? Dan? Thank you. CB3, thank you. Meeting is adjourned. Thank you.